I do, as I do, do as I do, do as I do. You're not going down. As I do, yeah. Do as I do, I do, as I do. Right now. Thank you very much. All right, now you can have your seats. Good morning, everyone. Today is our antenatal in this clinic, and today we are going to be talking about the importance of antenatal, most especially the antenatal health talk. Okay, now first of all, my name is Nurse Grace Benjamin, and it's nice to meet you. Okay, now, first of all, we are going to start with our dressing. For a pregnant woman that is heavily pregnant, it's not advisable for you to put on heels, right? Because if you are on heels and you easily slipped off from any misstep, it's going to affect the pregnancy. You might even fall off and it will now harm the baby. Then for the clothing, you're not supposed to put on something tight. It will make you not really comfortable. The clothes will be too tight and you are not going to be comfortable, and it's not going to bring out this discomfort. The shape will not be looking fine. So it's always advisable that you put on something free and very comfortable, something that you can breathe in, because once you are pregnant, a whole lot of things happen in your body system, your hormones, your mindset, your thinking and everything. So at that stage in your life, you need to be very free and comfortable. Now, our next point is exercise. It's advisable for all pregnant women to exercise once in a while. It's common with most, especially those for their first pregnancy. Once they are heavily pregnant like this, they feel weak, lazy, because the whole thing is tiring. Like they can't sweep, they can't do anything. They now feel, okay, this is opportunity for them to relax. They're not supposed to be doing anything. No, it's wrong. Especially at a particular stage of your pregnancy. It's called the late stage of pregnancy. You are supposed to be exercising frequently. Some persons prefer to carry load, lifts, anything like walk up a hill, come down, so that it will help with ease delivery. Because if you're the type that feel, okay, I don't want to do anything, nothing, I'm not supposed to do anything. Once it comes to labor room, you start shouting and screaming. The little effort we want you to put in, you will now feel, no, you'll be 2 weeks, sir. You will not have the strength, and you start shouting and screaming that nothing is painful. But once you've exercised your body, yourself, everything, it helps you and the baby. It increases blood circulation. It's always advisable, even for those that are not pregnant, to exercise, because it increases blood circulation from the heart to other parts of your body system. And anything that helps with the increment of blood to other parts of your body system promotes healthy life. It makes you more healthy, makes you more, now comfortable and the rest. But if you are pregnant and you don't want to exercise and the rest of it, it tends to affect you and the child. You will not be too strong and not too healthy. It's always advisable for a pregnant woman to exercise once in a while. For the routine drugs, which are our next topic, once you go for antenatal visitation and you get to see your gynecologist, that's the doctor doing antenatal, he always gives you this particular set of drugs that you should be taking in every pregnancy. Most people don't like taking it. Once somebody is pregnant, it's hormonal. It's not really an intentional something. They'll feel they don't like taking drugs, or the drug stinks. It is smell, I don't want to take them. It's not advisable. It's advisable to always take your drugs, because it does not only help you, it helps both you and the baby. You understand? Once you are pregnant, you are prone to some infections and the rest of it. You become weak because now your own blood supply is not just for you alone, it's both for you and the baby. That's why you see, once you are pregnant, you start having some blood vision, you will not be seeing clearly like that. It's because some part of your blood is going down so that the baby can grow. So you need more supplements to help you, so that you and the baby will be healthy throughout the pregnancy. So once you don't take those drugs, which means you are at a danger of having either infection or having anemia and the rest of it. So now the next topic is food. Food, which is one of the vital things in every human life. Now, in some persons, what do we know about balanced diet? When they ask some person, what is balanced diet? They will tell you that balanced diet is having, you cook food, maybe rice, you have chicken, you have coke and the rest, it's plenty and it's much and it's sweet.
they tend to see that one as what? Balanced diet. So when I say balanced diet, I mean a particular meal you want to sit down and it should have those 6 classes of food. That is what we call balanced diet. If you ask some person, do you eat well? They tell you yes, they eat well. Because they eat plenty, they think they eat well. No. You that eat little, but the food is quality and now, it's rich. But they eat in large quantity. But it's just, let's say they just have 2 or 3 classes of food here. And they feel they eat more healthier than you. It's life. So for the 6 classes of food, we have the protein, carbohydrates, fat and oil, water, minerals, and the rest of it. So once you have a meal and those 6 classes of food are not in those meals, some persons will be like, I don't have money for fish, I don't have money for meat. Mind you, when we talk about protein, we don't mean it must be fish or meat. We have other types of protein. Even this our local wara. If you cook rice, if you don't have fish, you can put wara. That wara or beans can also replace what? Protein. Then for the vegetable, you get a good vegetable you put. And don't overcook your vegetable if you want to get the nutrients. Then fruits and salads are also advisable. You can eat that in between meals and the rest of it. Then take enough, when I mean enough water. Enough water, it helps with blood flow easy and it helps to wash down your system. Then our next topic is traveling. You see some people, at their late stage of pregnancy, during their last 3 months, that is their 3rd trimester, that's when you see them traveling. They know that their due date is very close. They start going to far journeys like Lagos, and at that stage, they're not supposed to be on the road. Since you know you are in the 3rd trimester, it's best for you to be around the hospital facility or stay at home. Be set, be prepared, because at this moment and anytime soon, we say 2 weeks before your EDD and 2 weeks after are the period when you can go into labor and deliver. So it's advisable for you not to travel to distant places during your 3rd trimester. So our next topic is going to be on exclusive breastfeeding. Exclusive breastfeeding. Some women, they will tell you that, me, I cannot breastfeed my child, I don't want my breast to fall. So will say, I cannot breastfeed my child, I'm a career woman, I cannot be carrying my baby to work. Yes, they do it. That's why they have some baby milk now that they will just buy and just give the baby. The one that's even more advanced now, they have them. So I'll tell you that, no, I don't want to lose my breast, I don't want my breast to fall and the rest of it. See, exclusive breastfeeding is not easy. We know it's not easy. Yes, it's demanding, especially from the woman. But it has higher advantages on that child and even the mother. For somebody that went through labor or CS, normally they do give you injections so that your uterus that was open will go back to its former stage, contraction, so that everything inside will come out well, right? Even without that injection drug they will give you for it to work, once the baby starts sucking your breast, your hormone, there's a particular hormone called oxytocin that is being released. Prolactin and oxytocin. The prolactin produces more milk, which means milk will be coming out. Some person they will say, milk never start coming out. No, put the baby to the breast. Is that sucking reflex that will bring the milk? You understand? Some persons will be like, no, it's not, it's too early. It's never too early. It's never, even after the baby is out, some persons put the baby on top of your body so that you can create bonding and start breastfeeding. So it helps, once it releases that hormone, it helps contraction. It brings contraction so that your uterus, your tummy, can go back to the way it will be contracting and every other thing will come out. So I can go back to the way it used to be before. And the other hormones too that works alongside with it. Apart from that, that's for the mother. Then for the child, it has a great advantage. You see, I did a personal research. A child that had that was exclusive breastfeed and a child that is not exclusive breastfeed. Although some persons get intelligent from their parents and gene, but breastfeeding makes the baby sharper. It makes you see those people that are exclusive breastfeed, they easily catch things because it works on their brain. It helps build their brain. Their brain builds more heavier and it becomes anything that has to do with the brain. What happens? It will be more sharp. So you see them at a very tender age picking things that their age mates are not picking. So if you observe, you see. Yes, exclusive breastfeeding is not easy, but it's always advisable. Always advisable. And if you are doing it, you as the mother, you need to eat well. That's where balanced diet comes in. Eat what? Well. Alright, now our next topic is going to be on personal and environmental hygiene. Okay, I know all of us here knows what it means by environmental hygiene, keeping our environment clean, right? Yes. Personal hygiene, keeping our own self, personal self and personal stuff clean. Now, for example, environmental hygiene, you see some women, some pregnant women, always coming down, falling ill, malaria. And where they live, mind you, it's not all hands are not equal, but where they live, the little place you have, how neat is that place? You see some house very close to one kind of dirty gutter, and that gutter, they maybe clean it once in a year. Some houses full of grass, and mosquito breed in stagnant water that is not moving, dirt and grass. So what will help? Clean your environment. If your environment is clean, it tends to keep you more healthy. Then you yourself, personal hygiene, clean, like, be neat. Take care of yourself, your private parts, your body. Don't repeat clothes frequently without washing them. Then your undies, some persons repeat undies. It's not hygienic at all. Some girls do that, you think they don't. Put on pants, remove it, and wear it back again. So what are you now trying to say? You're trying to make it, in short, you are endangering yourself. So during pregnancy, you are prone. At that stage, you need to maintain a healthy lifestyle. Personal hygiene, keep yourself neat. Shave your outfit, shave your hairs. If you cannot do it yourself, tell your husband to do it for you. Yes, if you cannot shave, because based on the size of the pregnancy, you might not be able to sit down. Let him do it for you. Shave, keep yourself clean, your environment neat. Okay. Our next topic is going to be on family planning. Now, family planning, some persons will be like, okay, they have plan. Now, family planning is planning on how to space your child, the number of children you want to give birth with, and the space in between each of those children you want to give birth with. That's family planning. So now, some person will be like, okay, I have plans to give birth to just 3 or 4 children, but they end up giving birth to 5, 6, 7. How did that thing happen? I don't know. I be to say, you understand. So it's advisable that you go for family planning if you know you want to give a specific space in between your child, there's your children, and a specific number of children. We have the implants, we have the pills, we have the injections, we have the insertions. But it's advisable that you go for family planning, especially if you have plan of number of children you want and the space you want to give in each child. It's always advisable for people that undergo cesarean section. If you undergo cesarean section, they will tell you that you should not take it after like 2 or 3 years. 2 years ago, let's say yes, 2 years. They will not take it in the next year, 1 year time, because your uterus is healing. So imagine somebody that just undergo CS this year, she is pregnant next year. You see the danger it's causing to her own life. So you see, it causes a lot. So somebody like that is advisable that she goes for family plan. If you cannot abstain from sex, which is the normal calendar method, or your cycle, for those that know their cycle, if you don't know how to do the calculation, and if you cannot abstain from sex or use condom via method, it's best you just go for the family planning method and that yes. Then for the pills, it's not advisable. If you are the type that forgets, don't go for pills, because if you miss 2 or 3 pills, you have to start again. It might even take you if you have sex that time. So it's advisable that we do family planning to help us plan our family, number of children, and space in between each child. Then the next on my list is the 9 danger signs. The 9 danger signs in pregnancy. Please, these signs I'm about to mention are the danger signs that once you notice or see them, the next thing that should come to your head or mind is the hospital. you go to the hospital to see your gynecologist or your doctor once you notice, number one, bleeding through your vagina. You notice bleeding, please go to the hospital. You notice severe abdominal pain, not just the mild one. When the abdominal pain is becoming more frequently and more discomforting, go to the hospital. When you are vomiting so frequently, not just one, not just two, but it's coming almost all the time. When you put anything in your mouth, you throw it up, please go to the hospital. Blurred vision, you are not seeing too clearly, your eye is turning you, your eye is doing as if you are not seeing clearly, please go to the hospital. You cannot feel your baby movement again in your womb. You used to feel it before. Please, it's advisable that you go to the hospital. You're having severe headache, it goes and comes. Whenever it comes like this, it's always banging. It comes frequently. Please, it's a danger sign. Go to the hospital. You are convulsing or you convulse, you have a period of convulsion. Please go to the hospital. Don't ask your mother, your husband's mother or your own mother-in-law, your neighbor, anybody, or your pastor or your imam. Just go to the hospital. And you're having this one now is during delivery. The placenta is being delayed for 30 minutes. It's a danger sign. So they will need to do something now to bring it out. Or the labor is being prolonged. It's a danger sign. Or you notice that the baby is coming with the hand or the leg or any part. You can feel or you can just, or you know, it's a danger sign. Please conduct your gynecologist. And you notice that you are having cold. Please, severe cold, go to the hospital. Please take note of this I just mentioned. So the next on my list is preparation for delivery items. You are now due. You are close to your EDD. You want to give birth. You are not prepared. You've not bought baby clothes. You've not bought pampers. You've not bought everything you need. Each hospital, each clinic that offers antenatal services do give antenatal lists, delivery lists. If they don't give you the list, they will tell you to pay for the pack of it. So once they give you the list or they tell you to pay, please endeavor to be prepared. Get your hot water, your baby bag that contains everything you need. Keep it in one side. Don't use them. Once you are due, once you are in labor, if you cannot bring them, you can send somebody that will just go and bring them. You are set for delivery. That's the next one on my list is the care of the umbilical cord. Please don't apply toothpaste, don't apply the hair of a rabbit or whatever you know that they do in your house or whatever they tell you to do. Don't do. There's this gel that is called chlorhexidine gel. It's what you use to apply on the umbilical cord. It will make that cord to fall off 3 to 7 days. It's advisable to prevent infection to that baby. But anything that affects that umbilical cord affects the baby. So that is what and what. Then the next on my list is immunization. Please don't forget that after delivery, take your baby immediately for what? Immunization. Start immediately. And once they give you a card for when to come next, please get a reminder. Go frequently. Don't say I forgot, something came up. Please, you can tell somebody, okay, remind me so that I'll take my child for immunization. Follow you so that to prevent any future health condition. Now we'll be demonstrating some sex position during pregnancy, and I'll be showing you some safe sex position during pregnancy. The first on my list now is spooning. So just like that. Careful, sorry. We just turn towards the other side. So now, as you can see, she's heavy. I cannot be on top of her while having sex. So since she's on this part, I will just come from behind at her husband and have sex with her this way. I can insert my dick from behind and have sex. She'll be more comfortable and relaxed. No pressure, no stress. That's for spooning. Is called like cuddling sex position. So the next on my list is doggy position. Sorry. So in doggy position, she's going to be on her knee. So now you see this position, there is no pressure on the tummy, she's not in distress, no pressure, no discomfort. So the husband, which is me, I can have sex with her from behind. Might be standing, might be knee too, whichever, but she's going to be in this position. And this position is called what? Doggy position. So the next sex position is scissors. So this is how it goes. I will have to cross my leg this way. Go this way. See it back? See it now. So I can have sex with her in this position. My legs are not on her tummy, no pressure, no discomfort. She's relaxed and comfortable. So I can sit this way and have the sex, or I can lie and have sex with her. I can use her legs this way and be pulling her towards me. You understand now? So I can have sex with her. This is called scissors. So the sitting position on the husband, I'll sit on a chair or a couch, whatever place that is more comfortable, and she will sit on me this way. So as you can see, there is no pressure, no discomfort. I will be having sex this way. I can just hold her legs towards like this, or hold her hand. Some guys are more muscular, so they can actually lift their arm up and down, and have sex with her this way. So this position is called what? Sitting position. So these are the few safe sex positions we have in pregnancy. So you see, so whichever one you feel you prefer or you feel is more comfortable for you, you can just do and enjoy yourself and have a good and a safe delivery. All right, now once again, my name is Grace Benjamin, and thank you once again. You're welcome.